So I've discussed the causes for recurrent urinary tract infection. Ladies, when you go to the toilet, to ensure that you're not getting an infection because you're not emptying your bladder properly, ensure that you are double voiding. That means once you go, you attempt to apply some pelvic pressure by pushing gently to ensure that any remaining urine comes out. Women who get urinary tract infections very shortly after sexual intercourse, for you, if you're trying to fall pregnant, you might hold on to the sperm for a short while, but you need to have an intimate wash, after which you may need to be on a course of Lexin. Again, check with your doctor. An antibiotic for the next 24 hours after sexual intercourse. But I mean, it's for those of you ladies who get urinary tract infection like a clock. Immediately after sex, you get an infection. The antibiotic could be cefalexin or nitrofurantoin or trimethoprim, but the most appropriate one for you will depend on your doctor. Women who have diabetes, guess what? The best thing for you would be to keep your diabetes in check. Make sure you're taking your medications. Make sure that you are being good with your diet and not having a sugar-loaded diet. Also, some diabetic medications can cause you to have recurrent urinary tract infections like empagliflozin or dapagliflozin. Those medications will cause recurrent urinary tract infections. If that's the case, discuss with your doctor to consider changing these medications. For women who are menopausal, their vulval lining will be thinning, and for some, that is the reason why they keep getting infections. Discuss with your doctor using estrogen gel or Vagifem, which is another estrogen-based pessary, to replenish the estrogen in your vulval area around your urethra to prevent recurrent infection. Finally, for those of you who, despite doing all of those things, or you do not recognize yourself as having any of these issues, remember, a recurrent urinary tract infection may be a good sign that there is something wrong in the bladder, something as serious as cancer. So despite addressing all of these things and using all of these preventative measures, if you continue to get recurrent urinary tract infection, see your doctor. Recurrent urinary tract infection is defined as having 3 or more urinary infections within a year. That's infections that are confirmed by laboratory test as you having grown a bacteria in your urine. 3 or more infections within a year. You need to get an ultrasound done of your urinary tract system and be referred to a urologist, who will then put a camera through your urethra and look at the integrity of your bladder and possibly even scan your kidneys to make sure that there is no growth, no cancer, no lesions that is causing the recurrent infections. We'll see you in our next one.